certainly 73 new cases and an actual overall increase of 65 is good news, but it's not better or worse than's been modelled. It's more or less on track, but it's a track that is a good track in terms of where we're headed, and we've seen a steady but gradual decrease in numbers right through the last week, and is expected to continue from here. It does mean that we're easing the active cases that are in the community. We're easing the pressure on our hospital system in terms of hospitalised cases and ventilated cases, and the number of aged care active cases and disability cases continues to drop. Regional Victoria is equally on track in that regard. As you'd know, there were over 500 active cases at one point in regional Victoria, so to be at the 150 mark is a very gratifying figure to see. On the aged care outbreak deaths, as you know, 41 deaths reported today. There is a reconciliation that we've needed to go through. These are deaths that have happened over previous weeks, including going back to late July. There are Commonwealth reporting obligations, there are state reporting processes, and we need to reconcile those cases so that whatever the Victorian Aged Care Response Centre is reporting is absolutely consistent. The Commonwealth has strengthened the reporting obligations in early August based on a need for that VA IRC to have absolutely definitive data on deaths that have occurred in residents who have coronavirus, and so in early August there was a mandatory reporting to the Commonwealth that also goes to VA IRC on that basis, but some of that is being caught up. It is not about deaths having occurred just now or just in the last week. They are deaths that have occurred over several weeks. Of course, all of those deaths have been known to the facility. They've, of course, been known to the families of those residents. But it is heartbreaking to see a number of that magnitude, but it is a reflection of just how vulnerable those populations are and why we need to be mindful of the danger of this virus, especially in aged care settings, but also in disability settings and other places where individuals vulnerable to severe illness reside. I'm happy to take questions on that.
Professor Sutton, why has it taken so long for those numbers to come in then, and should we expect a further backlog to be coming through in coming days? I think most of these numbers are resolved. I think there will be some facilities that may still have a few cases to be reported through to the VA IRC, but I don't expect a number anywhere near close to 41 to occur again, but we will continue to reconcile with the Commonwealth numbers and to have a single source of truth in terms of reporting that.
Do we know if the majority of those 33 figures have come from one home or anything like that? Is that...
I don't know specifically. I don't think so. I think they've come from a number of facilities that have reported just recently.